We've had to act extremely fast and do what is best to protect our state from a COVID-19 outbreak. I'd like to acknowledge the work of the Police Commissioner, Chris Dawson, Chief Health Officer, Dr. Andrew Robertson, and their teams for the important work they are doing to keep us safe. I understand the changes made have thrown many people's plans into disarray. I know that must be very difficult to deal with, but we cannot afford to take unnecessary risks here. We can see the devastating impacts of the virus all around us, from Britain to the United States of America. This is a deadly global pandemic. We cannot forget that. I want to thank everyone for their cooperation and understanding as we implement these important changes. Western Australia is taking these important and extra cautious steps based on the most up-to-date expert health advice. Like I said last night, we are very concerned there will be many more community cases in New South Wales. And I note a further 10 cases have already been announced this morning. We've just come from an emergency meeting and been briefed by our Chief Health Officer on the latest situation in New South Wales. There is no doubt New South Wales is on the verge of a serious outbreak, and we must do whatever is required to keep us safe. Unfortunately, a case has now been recorded in Queensland, linked to the Sydney cluster, a person who travelled to Queensland by air just 2 days ago. This shows how the virus can spread, and it can spread quickly. Our best defence to keep COVID-19 out of our community is border controls. WA's controlled interstate border is in place for that very reason. Between December 11 and December 17, Western Australia has had 4,901 arrivals from New South Wales. This includes 616 people who have come from other parts of Australia but had been in New South Wales at one point in time since December 11. As a result of our border controls and the G2G pass travel registration, we've been able to reach out to each traveller and provide them with direct instructions. In addition, our contact tracers have followed up directly with 87 arrivals who have come from Sydney's northern beaches. This has been the added benefit of the controlled border, providing our health team and WA Police with the information they need to track down the people who are of greater risk. As expected, since our 3 p.m. announcement yesterday, our COVID testing clinics saw a significant increase in presentations. Yesterday, 1,936 people were tested at our public COVID clinics, including 522 at the airport on their arrival, with most of those arriving after our 3 p.m. announcement. This was a 172% jump on the 712 people that were tested at the clinics the day before. This is a very pleasing result to see that response. Those people are now in self-quarantine, awaiting their test results as per our lawful direction yesterday. I know many people have been caught in long lines and have had to wait for long periods. Thank you for your patience and for doing your bit to keep our community safe. WA Health have ramped up resources at our COVID clinics. Open hours have been extended across the Perth metro area and across our state. WA Health have also spoken to private pathology providers to ensure that if anyone presents for a test and has been in New South Wales since December 11, they are able to be tested. A full list of testing sites is being published